So now we're going to talk about the midface. The midface goes from the area between the eyebrows to the deep line that runs from the corner of the nose to the corner of the lip. That's called the nasolabial fold. And as we age, that area descends and the cheeks descend. They descend and they deflate. And also you can get fluid-filled bags on the cheeks called festoons. The midface is a very hot topic in facial rejuvenation right now. The idea is I can go to seminars and they can have whole days discussing the midface with different techniques. But the idea is to shorten the distance from the cheek prominence to the lower eyelid by lifting this area and by adding volume to augment the cheek. So I'm going to digress a little bit, and I say that there's three aspects to facial rejuvenation. One is to combat the ravages of gravity, and these are the three things, these are the areas of the face that we're talking about, and we're going to correct that with surgery. The other is to improve the way your skin looks, because the tone and blemishes and pigmentation can age you. And then the third is that with age we lose facial volume. So if you really want to rejuvenate a face, you need to add volume. And no place is this more important than adding volume in the cheek, because a youthful face is a full cheek, a rounded cheek, and that's part of what gives people a glow. So part of the mid-facelift is adding volume to the cheek. It restores a youthful appearance to the cheek, and it decreases the depth of the nasolabial fold. And we also eliminate the excess tissues and fluid-filled bags that are on the cheeks, which are called festoons. Now, when you evaluate the before and afters on the mid-face, I will tell you that these slides are two-dimensional. You can't get a full appreciation unless you learn to think in 3 dimensions. But again, she's preoperative on the left, after the mid-facelift on the right. So beforehand, you can see how sallow her cheeks are, how they've fallen, and there's no volume to the cheek, and they even have deep lines that run below the lower eyelids. You have deep nasolabial folds. And then after the surgery, you can see that the cheeks, first of all, we've shortened the distance between the cheek prominence and the lower eyelid. We've added volume to the cheek, and we've relieved the depth of the nasolabial fold. And this is more impressive in person than it would be in 2 dimensions. Again, similar, you shorten the distance between the cheek and the lower eyelid. We relieve the depth of the nasolabial fold. We add fullness to the cheek. The festoon, this lady had very prominent festoons. You can see them on the upper left slide, but even more on the lower left slide. It's that deep line that runs down and to the right, and that is not a bag in the lower eyelid. That's a deep fluid-filled bag in the cheek. So you're just not going to get that with eyelid surgery. You have to go to the mid-face in order to lift the mid-face and remove the excess tissues and fluid that are involved in the festoon. But I think we would agree that she looks so much better after the procedure than before, and she was not an old person. This is a much more subtle case, a younger patient. But again, we've added volume to the cheek, we've shortened the distance between the cheek and the lower eyelid, and we took away the small festoon that she was manifesting on the cheek, and how much better she looks after the procedure. And another patient, again, showing perhaps in between the last 2 cases. In the lower left, you can get an idea of the festoon that we're talking about. A lot of times, that's what bothers people the most, the festoon. And it's a fluid-filled bag, and you don't get that with a facelift, and you don't get that with lower eyelid surgery. And the only way to get that is with a mid-facelift procedure, which we frequently combine with lower eyelid surgery. But after the surgery, she has much more volume to the cheek, and the cheek is more continuous with the lower eyelid.